Greetings and welcome to the House of Friendship booth for Rotarians Against Malaria Global Rotary Action Group. That's RAM-Global for short. I'm past District Governor Ellen Blasey, and I'm the chair of RAM Global this year. Our Rotary Action Group brings together a diverse group of dedicated Rotarians like Rotarian Malaria Partners, Rotarians Against Malaria Australia, Rotarians Against Malaria Americas, and Rotarians Against Malaria PNG. You will also hear from some of our partner organizations like the Global Fund, RBM Partnership to End Malaria, and PATH. We are all working diligently to eliminate malaria from the earth. So please peruse around our booth, learn about malaria and about RAM Global Rotary Action Group, member projects and partner organizations. You'll see a short presentation about malaria, and then you'll be able to click on links to topics or speakers that grab your interest. We urge you to join us. As a member of RAM Global, we'll provide you with information about the progress of the fight against malaria. We'll offer hands-on experience to help you with your malaria project, or offer you opportunities to be part of an existing malaria project. You could also be a representative for RAM Global in your Rotary clubs, Rotary districts, Rotary zones, and at Rotary International. So just click on the button and join us now. Welcome and thanks for coming in. Now we head to Zambia, where we're going to meet with Dr. Nanthalile Mugala and speak with her about Rotarian efforts and the organization that she's with, PATH. Dr. Mugala, could you tell us something about your personal relationship and how malaria affected your life?
I'm a pediatrician first and foremost. And so in my early days, I worked at the tertiary hospital. And of course, working at the tertiary hospital, which is the biggest referral hospital in Zambia, based in Lusaka, meant that we were at the tail end of receiving all the severe cases of malaria. So I've seen it all. I've seen children come in really severely ill from malaria and dying. Yeah, I've seen a number of children dying from malaria for various reasons. First of all, sometimes they would come in late, but a number of them would come in with complications, and this is not uncommon. So children tend to develop severe malaria very early and develop complications really fast. And one of the commonest cause of death in malaria is severe anemia. And so when you're working in a system where to get blood for blood transfusion can also be a challenge, you find that you lose a number of children simply because you cannot transfuse them. And so that's why it's so important that you should be able to diagnose malaria very early on and be able to treat it before complications set in. So I've seen it all. I've seen children die from malaria. I've seen adults die from malaria. But even when I joined public health in the last 15 years, I traveled to the most remotest part of Zambia in my line of duty. And there, the situation could even be much, much more challenging. You know, where you go to a health facility, and of course, malaria is one of the commonest cause of attendance at the facilities. So again, I saw it all. So children coming in with severe malaria, but where you have now even challenges to get this child to the next level of care, where they could actually access services to manage, you know, like where you could even have a blood transfusion, because when you're looking at the primary level of care, which is like the health center or the facility level, which would be, you know, the primary level of access for care for most of these households in the rural communities. If you have to then refer that child to the next level of care, which would be a district hospitals, then you have the challenges of you have transport, or sometimes are the roads accessible? So there are all these other additional issues that you then are faced with. So again, yes, I've seen it all. I've cried in my own private space sometimes, because I've seen really healthy, bouncy babies coming paper white meaning severely anemic from malaria. You know, and then you're just looking, because you cannot transfuse them, because you can't get them to the next level of care. And this happened to me before. And the next thing you find, this child dies, and if it's in the most remote areas, you would not normally have a mortuary, for instance, at the health facility level. And so the parents would have to take the body back to their community to go and bury this child. So it's not something that you get used to. I know, you know, I think most times people feel because you're a medical doctor, you get used to seeing these kinds of unnecessary deaths, but you don't. Yeah, you have to put up a face because you are there trying to act strong, but in your own private space, you shed a tear or two. So yeah, so I've you know, but that's not just from my work perspective. I've also lost close friends and relatives from malaria. You know, we have grown up in Zambia, which malaria has always been there for us throughout. So yes, so I've seen it from the perspective of my work. I've seen it from the perspective of my own life, in my social life, in my family, and you don't get used to it. So,
how big of an issue is malaria in Zambia, and what are Rotarians do to help solve it?
And so malaria happens to be one of those big priority programs for Zambia, because Zambia, as you might know, is endemic to malaria. So basically what that means is that almost every part of Zambia does have malaria. And so the role for PATH in supporting the malaria program, working with the Ministry of Health and the National Malaria Elimination Program, has been to accelerate the reduction of the malaria prevalence, incidence, as well as malaria disease, and deaths. And so with the malaria program, yes, we have forged a very long-term partnership with the Ministry of Health. And this has been based on a lot of the work that we have done that has been very impactful along the years. Our reputation that we have gained as an organization that provides or works very closely with the Ministry of Health in looking at long-lasting solutions programs or diseases like malaria, in advancing and introducing certain approaches or tools that help to address issues around malaria. And I must also mention that as PATH, we take particular interest in forging good partnerships. So even when we work in the malaria program, yes, we're working with the Ministry of Health, but it's also very important for us to work with other stakeholders. And we worked very closely with Rotary, the partnership that is looking at supporting malaria programs as one of the key partners that we work with as PATH here in Zambia, as well as globally.
Dr. Mugala, how are Rotarian Malaria Partners, RMP, supporting you? I believe you have a partnership with them.
Well, I know that Rotary Malaria partnership based in Seattle has been supporting the malaria program as one of their key stakeholders. So the National Malaria Elimination Program in Zambia, which is a branch of Ministry of Health, is supported by a number of stakeholders, and the Rotary Malaria Partnership happens to be one of those stakeholders. PATH also is a stakeholder, as well as many other organizations and stakeholders that have got an interest in investing in the malaria program. So I'm aware that the Rotary Malaria Partnership has been working with the Ministry of Health and the National Malaria Elimination Program for a number of years now, supporting malaria interventions, especially in the Copperbelt province. And so this cuts across a number of activities that the Rotary Malaria Partnership has been able to invest in through financial investments, and working with the team at the National Malaria Elimination Program, as well as the respective districts in where the interventions are actually happening. And so that support goes across, capacity building. So, having finances to actually build the capacities or train the providers of services for the malaria program, both at the facility level as well as the community level. Provision of supplies and equipment that enable the providers of services for malaria, especially at community level, to be able to do their work more efficiently.
How do mosquito nets help prevent malaria in Zambia?
The nets are used to prevent malaria, and normally would be distributed at household level so that people can actually sleep under the nets, so that they prevent themselves from being bitten by the mosquitoes. And I know that the Rotary Malaria Partnership has been very key in supporting the provision of nets through procuring nets, and these nets are then given to the respective communities and distributed at household level.
How do you cover remote locations to cover all of Zambia?
We have some interesting ones, especially at community level, that would actually show the distribution of nets, would show the community health workers, which is a cadre at community level that would go to households and to test and treat for malaria at household level. So these are volunteers that are trained and given just the basic skills to be able to train, to be able to test and treat malaria at the household level. And that's very, very important because that then allows households to have access to malaria services, diagnosis and treatment very near to where they live, so that if they have all the symptoms of malaria, they can easily be diagnosed and treated before they develop severe disease. And this is something which is very important when you're looking at how fast malaria can progress, especially in the younger children, especially the children under 5 years, and the pregnant women. So it is very necessary that the services are brought as close to the household as possible.
Thank you so much, Dr. Mugala, for the work that you're doing. And thank you for joining us today and enlightening us on PATH and on what Rotarians are doing in Zambia.
Okay, thanks.
Coming up next, we're going to hear from Jeff Pritchard and Jim Moore from Rotarian Malaria Partners and all the great work that they're doing to eliminate malaria.
We need your help at RAM Global. Join us to deliver mosquito nets, to train community health workers to drive malaria to zero. Your dues and your club's dues. Yes, clubs can join RAM Global. This is the time when we need your attention and help. Become a member today or donate in just a few easy steps. For more information, visit www.ram-global.org. www.ram-global.org. Thank you for your help.
Next, we head over to Seattle, Washington, in the United States, where we're going to meet with Jeff Pritchard and Jim Moore of Rotarian Malaria Partners, RMP, and we'll hear about their group and how they take part in malaria elimination. Take it away, Jeff.
Well, thank you, Ellen. Jim, welcome. Could you tell us a little bit about Rotarian Malaria Partners?
It's a pleasure to do that. Rotarian Malaria Partners was founded almost a decade ago by a group of Rotarians that were working on malaria projects in Africa. And as a consequence of their work, they realized the need to have a fundraising organization with a bit of a broader reach than just being Rotarians. And so they established Rotarian Malaria Partners. The vision of Rotarian Malaria Partners is a world free from malaria. And our mission is to create a broad campaign among Rotarians to have malaria be the next global health target after polio is eradicated for the Rotary Foundation and Rotarians. So that's how we got started. And we have a board of 21 people representing 8 now, I guess, different Rotary clubs. We have affiliates, Rotarian Malaria Partners Zambia and Rotarian Malaria Partners Uganda, that are made up of the Rotarians in those 2 countries. And we have as well worked with Rotary organizations and Rotarians in other countries.
Great. What you mentioned Africa, is that the area you primarily work in? And what kind of projects do you focus on?
Well, it's good to remember that we work at 2 levels. One, we're an advocacy organization from the standpoint of explaining, making Rotarians aware of malaria and the devastation that it creates in rural communities in poor parts of the world. And then the second is our on-the-ground support for projects undertaken by Rotarians. The kinds of projects we've undertaken over the years have spanned all of the kinds of interventions that affect the prevention, control, and elimination of malaria, from providing bed nets to rapid diagnostic test kits to our major efforts lately, which is training and equipping community health workers and putting them in their home villages for the establishment of a first line of healthcare at the village level.
Great. Can you explain a little bit about, I think, one of the more exciting things that RMP does, and that is the small grants program?
So one of the advantages, of course, of being a 501c3 organization is that we are able to raise funds and then make those funds available to projects. And we have a program called Small Grants, and those are grants of up to $5,000 that are available to Rotary clubs in malaria areas to malaria. We also can match those funds from other sources. There is a matching fund that has been established by the Bill and Melinda Gates Foundation, a dollar for dollar matching fund for Rotarian contributions to anti-malaria projects. And that can be applied as well to the small grant projects that we have. And we have on our website the application process for those $5,000 grants.
Great. So you partner with the Bill and Melinda Gates Foundation. I know there's a lot of other organizations that have been very proactive in wanting to partner with RMP. Can you mention some of those and some of the areas or how they want to partner?
We've partnered with a number of large organizations besides the Gates Foundation, which has also provided some funding for Rotarian Malaria Partners and our affiliates in Uganda and Zambia. We partner with PATH, which is a global health nonprofit that is based in Seattle, but works around the world on a variety of health programs and has a big anti-malaria presence in Zambia, for example, as well as other countries. We partner with the Alliance for Malaria Prevention, which is a Geneva-based advisory organization that helps countries do national net distribution campaigns, and it's located in the International Federation of Red Cross and Red Crescent. Malaria No More. In Uganda, it's Pilgrim Africa is our partner there on projects, anti-malaria projects. So yes, we have a gamut of partners, and have enjoyed, as it's gotten going, a very close relationship with RAM Global, the Rotary Action Group.
You're currently spearheading a very large global grant, $1 million. Wonder if you can share a little bit about that program, because it's pretty impressive what you're pulling together.
Rotarians in Zambia decided that they wanted to undertake a program to eradicate malaria from an economically very important province, the Copper Belt, with a population of 2.5 million people. And so they began, and we participated in several projects that are designed to essentially get to the last mile of Rotary action against malaria. That is to get as close as possible to elimination. And they do that with these projects by training and equipping community health workers so that they can work in their home villages. So far, one project's been completed that has placed 300 community health workers in 2 districts of the 10 in the Copperbelt province. A second project is underway in a 3rd district, and we have just submitted our application to the Rotary Foundation for approximately $1 million project that will put 1,055 community health workers into the field in their home villages, where they will diagnose, treat, and report on malaria, as well as diarrhea and respiratory illnesses. So they actually become that first line of healthcare for people in their home villages, often who are tens of kilometers away from the nearest health service or health facility.
Great. I know the board members of Rotarian Malaria Partners are always willing and able to make presentations at various clubs about both malaria and some of the programs we're working on. Can you maybe just explain a little bit more about that?
Sure. Glad to do so. We have, as part of our advocacy, as well as helping the African clubs that we work with in places like Ghana, the Gambia, Zambia, Uganda, Tanzania, raise funds from Rotary clubs by giving presentations to them. And, in these days of the coronavirus, those have been, of course, on Zoom or GoToMeeting or whatever telemeeting technology is available for and used by a particular club. And, we can do short meetings that are 5-minute summary of what's malaria and what is the status of that disease compared to, say, COVID-19. We also can do longer presentations as well that have been found to be quite informative and interesting to our populations, at least, that don't have much experience with malaria.
Well, thank you, Jim. That was great. I'll turn it back over to Ellen now. Thank you.
Don't leave us now. Next, you're going to hear from Steve Baker from the Rotary Club of Key Biscayne, my home club, and he's going to tell you about the great work that we've been doing in Venezuela to combat malaria.
How do we stop a deadly disease that's spread by mosquitoes? Because the disease is only in the poor countries, it doesn't get much investment. Bed nets are a great tool. What it means is the mother and child stay under the bed net at night.
Malaria should be a relatively simple disease to solve. And yet, to this day, hundreds of thousands of people are going to die from the bite of a mosquito. If you have malaria in your society, your economic growth is depressed by 1.3% every year.
Some estimate it has killed half of everyone who's ever lived on Earth.
Saving a child from malaria is more basic. Let's get a bed net out there. Let's get this kid to grow up in a healthy way, not have the cerebral malaria that permanently damages these kids' cognitive abilities.
Welcome back. We are here back in South Florida in the United States, home of the Rotary Club of Key Biscayne, which is the Rotary Club for me and our next guest who's joining me now, Steve Baker, the inventor of the Mosquetero and all-around good guy who's going to tell us about the work that he's done in malaria in Venezuela and some other information about what's going on there. So, hi, Steve.
Hi, Ellen. So I can't claim to have invented the Mosquetero. I have to say off the start. It's simply the it's simply the Venezuelan Spanish word for mosquito net. And one thing that's different about mosquito nets in Venezuela is that people who we were getting them for, and we'll get into that story, I'm sure, sleep in hammocks generally.
How did you get involved with malaria?
My wife and I were living in Venezuela from 2001 till 2006. We were there because she worked for an international company and Procter & Gamble, and their headquarters at the time for Latin America was in Caracas. So we were in Caracas. And Peggy traveled a lot on business. And when she traveled, I went with a buddy of mine who had a small plane. We'd fly into a part of the Venezuelan Amazon. This was for adventure and travel, basically. And we'd fly into this area called the Alto Ventuari, the Upper Ventuari River Valley. And we stayed with Yacuana and Sanama people there. And made friends with Cacique Isaias Rodriguez, a wonderful fellow and our sponsor when we were in the area. There were no military, there were no police, there were just Yacuana in that area, and we only way we could travel there was with his say-so. Anyway, we got to know him and his people pretty well, and at a certain point, Isaias asked me to help him with malaria because it was really very bad for the folks who lived there. They were getting infected a lot. Their shaman could deal with other types of domestic illnesses, but not with malaria. So people were getting really sick, and they were miles and miles and miles by boat away from the nearest hospital, like 3 days. It was tough. So I promised I would try to do something, and over a period of time, and with some advice, settled on the idea of insecticide-treated bed nets. And along with the local people there, we designed a bed net that would cover their hammocks, and a company called Insect Shield put permethrin on them, long-lasting permethrin, and we started giving them out. Peggy and I financed about, I'd say maybe 500 nets over a couple of years. And then we left Venezuela and ended up in Florida. And a friend of mine said, I was trying to raise money for more nets. And a friend of mine said, well, why don't you go and talk to the Rotary Club there in Key Biscayne? They might give you some money. So I did. I went and talked to the club, and they did indeed give me a contribution so we could get some more nets. But I think Ellen heard me at that time, and Rotary just changed the whole dynamic of the project. We went from hundreds of nets to thousands of nets to tens of thousands of nets. Our latest global grant delivered close to 70,000 nets. So these are insecticide-treated nets that are affected for 3 to 4 years and kill mosquitoes on contact. They're a fantastic product.
That's terrific. So, Steve, how did malaria reach epidemic levels in Venezuela? I thought Venezuela was a rich, developed country.
Well, malaria has had a quite checkered history in Venezuela, as well as lots of other parts of Latin America. Most people believe that it came to South America with Columbus and with the conquistadors, and it was never seen before then. So not really a domestic disease, and it was really hard on the people at the time. So in the early records were kept in the late 1800s and early 1900s, and which showed Venezuela had a hugely high mortality rate, 164 per 100,000. Is a really high death rate, the highest death rate in Latin America from malaria, and it was endemic all around the country. In the 1930s, an American and European educated Venezuelan doctor, his name was Adolfo Gabaldon. Gabaldon, who by the way was a Rotarian from Maracay, he started an institution called Malaria, and over the next 10 or 15 years, they pretty much eliminated malaria except for very small pockets throughout the country by spraying DDT, spraying other chemicals on walls of houses to kill mosquitoes. And they also had a program of electrification and improvement of housing throughout the country, so that a lot of malarial breeding spots for the Anopheles mosquitoes were eliminated. When Peggy and I got there in the early 2000s, malaria was down around 10,000 cases a year, way down. It had been on the rise though, slowly. And during the time we were there, we saw a problem that came. I don't want to get too political here, but the problems that came from the Chavez government's neglect of the disease is a basic way of saying it. And it started getting worse by the time 2012 rolled around. There was around 30,000 cases, mostly in Amazonas. But in 2014, some really dramatic things happened that wrecked the Venezuelan economy and pauperized the country. And that is the collapse of oil prices, and also a great deal of mismanagement of PDVSA, the crown jewel of Venezuela, their oil company, combined to see a complete economic collapse of Venezuela. And during those 18 months there, starting in 2014, millions of people left the country, fled, including perhaps 40% of the doctors and nurses in the country. And money for malaria prevention completely dried up. Partners from previous Mosquetero projects that we'd worked with, like Dr. Jorge Moreno, was completely his institution was defunded completely. Drugs to fight malaria dried up completely, and the rates jumped to probably 250,000, 300,000 infections that year in 2014, more in 2015, more in 2016. It was estimated in 2016 that there was as many as 1 million infections in Venezuela. So things got really, really bad. And that's about the time when this latest global grant that we got, global grant, Mosquetero project, Leone Rossi, was ready to start delivering nets. So it was a really good time for us to be active in Venezuela.
That's wonderful. I know that you've done some really great work there. So tell us, Stephen, how do bed nets change the rate of malaria infection?
So I'm just going to mention a couple of real basic facts. Malaria is a parasite that needs both humans and mosquitoes to complete its life cycle. If you kill all the mosquitoes, there won't be any more malaria. It'll die out. If you kill all of the people, equally, there won't be any more malaria, but we prefer killing the mosquitoes. It isn't possible in a place like Venezuela, where there's water everywhere and bazillions of mosquitoes, to kill them all using chemicals. It's just not possible. However, when you deploy long-lasting insecticide-treated bed nets, so LLINs, long-lasting insecticide-treated bed nets, these nets kill the mosquitoes that come into contact with them. They don't repel them, they kill them. And so what you have when an entire community uses bed nets, I did get off track for a moment. This mosquito bites at night. The Anopheles mosquito that passes malaria to people bites at night. And if you interrupt that biting people by the infected mosquitoes, then you stop malaria. And the bed nets do exactly that, because they kill mosquitoes that are coming for us. If you can imagine a village full of people breathing out carbon dioxide, attracting mosquitoes from all over. The Anopheles lives out in the jungle, not in your house like the Zika mosquito does. This one lives out in the bush, but it follows that carbon dioxide into the house and heads towards the person and hits the net and dies. And the level of mosquitoes in a village where everybody is using a net drop dramatically. That's why we can get, and it imparts a kind of herd immunity, a word that's been used a lot lately, but it truly does. So studies have shown that people who come and visit a village where everybody's using nets, they don't have a net, but they still don't get bitten because there's such a low level of mosquitoes due to the use of these nets. A key part of that is that everybody uses their net every night and uses them properly and treats them properly so the chemical isn't degraded by hanging them in the sun, for instance.
Right.
So we spend a lot of time training people who are distributing these nets, and we have a handout that tells people how to treat their nets and how to use them. When we get good compliance, we can see 83, 84% reductions in malaria infection rates from the nets alone.
Wow, that's terrific. Wow, that's just really great.
I should add that when the compliance isn't good, Ellen, that drops, but it doesn't drop to zero. It drops to 50% or so. Prevention of drop of infection rate. But when you have good compliance, it's amazing what they can do.
Right.
Sorry, one other thing.
No, it's okay.
We do not believe in the model of giving nets only to the most vulnerable pregnant women and children under 5, because they are far more effective if you concentrate them on a village. So we would rather give 1 or 2 or 3 villages enough nets for everybody to sleep under a net than giving a certain class of people in 100 villages nets, because giving in one village, covering them, that's more effective.
Okay, very good. So, Steve, how many people has the Mosquetero project protected from malaria?
The latest edition, this latest global grant, gave out in total 67,595 nets. We know from past studies that people sleep, multiple people sleep under these nets, whether they're on a bed or whether they're in hammocks. We took some data that we had. My wife, the mathematician, did an analysis on it and tells us that 2.5 people sleep under each net. Well, we kind of round that out and say 2 people sleep under each net. And that comes out to 135,000 people protected for 3 years from malaria.
Right.
We've given out over a series of Mosquetero projects in Venezuela and also in Peru, close to 80,000 nets now, maybe a little closer to 90,000. So you can see, you multiply, it's close to 200,000 people now.
Right. What wonderful work. Thank you, Steve. Thank you for all that you do, for your passion in eliminating malaria. And thank you for being with us in our House of Friendship.
And Ellen, thank you for getting me involved.
Thank you. Stay tuned. Next, we head down under to Australia and meet with Jenny Kerrison and hear the great work they're doing in Timor-Leste and the Solomon Islands.
Some estimate it has killed half of everyone who has ever lived on Earth. It has wrecked economies and caused more suffering than any disease in history. And today we're at a turning point. After a decade of progress, we can now chart the course toward one of the most epic feats in history, eradicating malaria. This is where you come in. Rotarians are people of influence and compassion and service above self. We know how to get things done by leveraging the best of what makes us human in order to achieve impact at scale for millions. We are calling on Rotarians around the world to use their influence, service, and generosity to support an international Rotarian campaign for the global eradication of malaria. When humanity's deadliest disease is one of the cheapest to end, then ending malaria is one of the best investments we can make to save lives, drive economic growth, and change the course of history for hundreds of millions of children.
Welcome back. Now we're going to head down under, where we're going to visit with Jenny Kerrison from RAM Australia, and she's going to talk about the great work RAM Australia is doing and projects in Timor-Leste. Hi, Jenny.
Hi, Ellen. Thank you, and nice to
see you again. So, Jenny, tell us a little about yourself.
Thank you, Ellen. I'm a nurse and midwife, and I still do a bit of work at the local hospital here. So I'm now in Hobart, Tasmania, Rotary District 9830. So I've been a nurse for a long time, a few decades, and I completed my Doctor of Education as well as PhD. And now I work almost full-time for Rotarians Against Malaria.
So, Jenny, RAM Australia was established in the mid-1990s. Tell me about its history, its goals, the current structure and function, and has it changed much since it was established?
Right, yes. So it was established in response to the increases in malaria in PNG and Solomon Islands. After DDT, the use of DDT was stopped for indoor residual spraying in the early 1990s, huge resurgence of malaria occurred in those countries. So Rotarians in Australia then had to do something, and that was the start of Rotarians Against Malaria in Australia. And from there, Rotarians Against Malaria PNG, or RAMPNG, was established in PNG. And as you know, they do great work. They are the principal recipient of Global Fund. And, you know, they deliver millions of nets. The last count was nearly 12 million nets in PNG, in a country of 8 million people and difficult terrains. Yes, so I'm fortunate to step into RAM as it's fairly well established. We're we're over 25 years old, RAM Australia, and we're affiliated, we're governed by Rotary Australia World Community Service. So therefore, we've got a structure we can follow, and we also follow the network. So we're a multi-Rotary district organization.
So has it changed much since it was established?
I think we've slowly moved from just malaria control to trying to do more, like health system strengthening. But as Rotarians, I think we're really well known for being on the ground, doing things like building, sheds for storing mosquito nets, helping with building laboratories, and that's what we're known for. But I think we need to slowly move away from delivering nets to strengthening the health system and making, the surveillance for malaria work much better than what we know in most developing countries. Yeah.
Okay. Well, REM Australia has been successful in gaining support from Rotarians, as you mentioned, for malaria control and elimination. Tell us some of the key strategies that made the organization successful.
Our success is really largely due to the fact that we are supported by Rotarians. So we get quite a bit of donations throughout Australia, and we have been able to then donate to our partner countries. So we have 5 partner countries at the moment. We have PNG, and we have Solomon Islands, we have Vanuatu, West Timor, and Timor-Leste. So this year we included West Timor so that we could do work at the border areas to help Timor-Leste as well as West Timor. I think that's our key success, the funding we get from Rotarians in Australia. So we've been able to sort of coordinate the humanitarian efforts and supported by Rotarians to do that. I think that's the key success, yes.
So what can REM Australia offer Rotarians?
Well, locally, we coordinate the Rotarians' spirit and need to do humanitarian good work in our partner countries. So locally, we offer them a focal point in if they want to reduce malaria and get on to this important mission that we're on, that RAM Global is on, and that is to eradicate malaria across the world. But locally, we want to eliminate malaria. So I think that's an important thing, that we're offering a network in Australia to help Rotarians in Australia. But more importantly, our model, we hope we can help other countries to set up network as well. Rotarians are everywhere, every corner of the world. And I think that's our biggest asset, is our network. And hopefully we can share that with other countries within RAM Global group. Thank you.
Yeah. Thank you. What are your challenges going forward?
Funding. Just this, we've done our financial analysis. We know that we have our income in the last 12 months has reduced by 50%. That is a huge drop Yes.
Yes,
So in
yes.
Australia, we've just had fires. Last year we had terrible trouble with fires. We've had drought. Now we've got COVID-19. So naturally we saw a reduction because of that. And I think we will recover slowly, but it just means that we've got to work harder to reach more clubs than what we've done. And I know we can push further with that. Yes.
Excellent. So, Jenny, tell us a little bit about what your program in Timor-Leste is.
Right, Ellen. Timor-Leste is one of our success stories. They get a lot of help from Global Fund, and it's a terrific program. But having said that, they also have a tremendous team. There is a WHO technical consultant working for them, and she has been working on this malaria program for nearly 10 years. So that consistent technical input is so important. And they also have a really good malaria team. So there is a national malaria program with a network of malaria officers throughout the 13 districts. Now, bear in mind, they only have 1.2 million people. So I guess with funding and a good, strong team and great technical leadership from WHO, they've been able to bring malaria down from 223,000 in 2006 to now 0 indigenous malaria.
Wow.
With 9 imported cases. So it's just an incredible performance. And Rotarians have been there for the last 14 years. So we started helping them in 2014, and we're continuing with our support. Not a lot of funding every year. We have got a large Rotary Global Grant for them, $250,000 in 2019, and that's running out now. So we hope to do another small grant. As they say, foot off the gas pedal, and malaria could just re-emerge. And yes, so we don't want that.
No, we absolutely don't. We want to keep marching forward and repeat those successes other places.
Yes, correct, Ellen. Yes.
So, Jenny, thank you so much for being with us today and sharing with us about RAM Australia and the work that's going on in your area of the world. And folks, if you want to know more about RAM Australia, please visit their website or come to ram-global.org, and there's lots of stuff about it.
Thank you, Ellen.
Thank you.
Thank you, Ellen, for all of the work this past year and for setting this up. My name is Drake Zimmerman. I am the incoming chair of the Rotarians Action Group on Malaria, RAM Global. I'm actually one of the co-founders, and I have the pleasure today of speaking with Joshua Levens. And Josh, would you give your introduction so you get it all exactly correct, and then we'll go from there.
Sure. Thank you very much, Drake. Yes, my name is Joshua Levens, and I'm the manager for the Advocacy and Resource Mobilization Partner Committee of the RBM Partnership to End Malaria, the largest global platform for consensus building, convening, and coordinating of global malaria partners. It's a pleasure to be here.
Some people have mentioned that malaria control may be one of the largest peaceful undertakings in humankind, in human history. And judging from the fact that it's been happening with all of this cooperation, but over what, 50 countries over the course of a few decades now, that may be actually accurate. So
well, and we are still continuing to see malaria as perhaps one of humanity's greatest struggles that has been with humanity since the beginning, has even formed the the background of our genome as we've evolved to adapt to the disease. So it's been really phenomenal to see some of that amazing progress, which has not just included the saving of lives and the preventing of cases, but has seen malaria elimination in countries that have historically been plagued by malaria for thousands of years.
Because 3 years is magic in ending malaria, isn't it? It's like polio. You have to prove that it's gone for 3 years.
Once the World Health Organization has done a thorough review and confirmed that indeed there have been 0 cases of indigenous transmission for 3 consecutive years, then they do award the malaria-free certification, which we're all crossing our fingers and hoping will be announced for China either at the end of this year or the beginning of next year.
So would you talk about the economics a little more?
Sure, and it has continued to be one of the best buys in global health. Actually, the World Health Organization has recently done an updated analysis reviewing some of the work that Sachs did at the beginning of the millennium to see, now in this period of post scale up, are these effects still seen? And the evidence they showed in that review was, in fact, that there's still, even with the massive scale up we've had, there are still substantial effects being seen. And I think it's obvious in a way from an understanding of simply how malaria affects communities. It doesn't trickle out evenly over the course of an entire year. It comes in waves, particularly following rainy seasons, when transmission gets very high. And at this time, you end up with large numbers of patients who overburden health facilities by all coming in at the same time needing one service. Mm-hmm. And so this is where you will see not only the health system being freed up, but all of the other local industries that rely on those workers who are being laid out by malaria to be able to show up to work because they're not all being taken out at the same time.
Okay, so people show up to work, they make money, they plant their crops, they tend them, they take care of their families, and that has this huge, they can take their crops to market and sell it. So it has this gigantic economic impact. That makes great sense.
That's absolutely right. And in addition to that, we continue to see that it's not only workplace productivity, but it's the overall desirability and market health of the malaria endemic countries themselves. When countries can go from high burden to low burden, or from low burden to zero, they reach a new level of desirability for more skilled workers. They reach higher desirability among clients who would do business in that country, or tourists who may want to visit that country, and even things like insurance that's required for conducting operations in a malaria endemic versus a malaria-free country. You will see these economic benefits at multiple stages, from revenue collection and workforce issues as we just discussed, but as well for marketing and being able to grow the economy and to attract new clients and a higher caliber of skilled worker as well.
What advice would you have for the Rotarians who are looking to work in a given country?
Well, I think you said something I want to repeat, because I probably should have started the talk with it. And it's worth saying again that this is a fully preventable and fully treatable disease. And so the effort that's needed is not the development of a brand new cure, although of course the research and development pipeline for new products is important. We haven't had a chance to talk much about that, but I will say that. But nonetheless, with the tools we have, there is so much that can be done with improved human resource efforts. One of the pieces of advice I would give, and I'll draw a bit on the experience that has been shared with me by our CEO, Dr. Abdurrahman Diallo, who was the Minister of Health of Guinea during the Ebola outbreak, and of course, who also had to deal with polio in his country in addition to malaria. And part of what he said is, these epidemics, they expose the underlying health system flaws in the country. And if we can identify and fix the health system using indicators such as malaria, it becomes a way not only to ensure that we achieve our objectives for malaria elimination, but that in fact we are paying the maximum dividend for that society forward. And I can say as well that if a Rotarian club is looking at a potential intervention in a particular country, countries have excellent peer-reviewed national strategic plans. There are great plans in place. The problem is these plans are usually funded no more than 50%. And so a lot of what's really needed is to be able to provide some of the additional support and resources to help implement these plans in countries. And I think, some of the things you touched on from larviciding and environmental management to mass drug administration, a lot of these kinds of interventions, they have already been well thought out and, and placed within the context of a national strategic plan. However, with a limited pot of resources, they often get put, into the pile of activities to be done only after we've made sure that medicines and test kits and bed nets have reached all of the vulnerable populations. So I think I would want Rotarians to know that in any malaria endemic country, they have an excellent technical partner with all of the support of RBM research and technical partners who are working with these malaria program managers day in and day out. And so there are great plans in place. And really what's needed are more individuals to join the fight and, declare as we do that zero malaria starts with me.
This has been an absolute delight. Are there any parting comments?
No, other than, likewise, it was a pleasure to talk with you and on such a great wide-ranging set of issues. I think the only thing to leave everyone with is if you've not already familiarized yourself, you can go to zeromalaria.africa and learn all about the Zero Malaria Starts With Me campaign and what you can do as a Rotarian in your club, wherever you are in the world. And we hope that this is a media toolkit and resource that really will be of use across the Rotarian community.
And that's something, a very, very hopeful message that you're saying. And we couldn't have done it without all the gigantic effort that Rollback Malaria, RBM, you and everybody else has put in here. So thank you very much, Josh. It's been a treat. I look forward to interacting with you in the future. And let's turn this back to Ellen now.
Thank you, Drake and Joshua. From Illinois, now we head to Geneva for our next interview with John Fairhurst of the Global Fund and Michael Hayward, President-elect of the Rotary Club of Thonon-Genevois International.
Thank you, Ellen. I'm here today with John Fairhurst, Head of Private Sector Engagement, the Global Fund. John, I've got 4 questions for you today. The Global Fund was created in 2002 to raise funds, manage and invest in response to 3 of the world's biggest infectious diseases. What has been your experience of that fight, and how is it relevant to the current COVID-19 context that the world is facing?
Well, Michael, thanks for the question, and a really interesting one, obviously, in the current times. I mean, I think that the Global Fund, as you said, has been around for 20 years, and there's been significant progress over that time in fighting disease, in essence, in fighting pandemics that have been around for a long time. Malaria, TB. have been around for many, many, many years. HIV more recent, but still a significant number of years now. So, I mean, I think the experience is that it is possible to make progress in fighting disease. The Global Fund has saved 32 million lives over that time, seen mortality rates drop by a half for malaria and HIV, and significantly in TB too. I think what it's also shown, though, is that it requires significant investment, significant leadership, and of course that's something that I think we're seeing, very clearly in current time, is that the leadership of governments and ministers of health, the leadership of global organisations to help support and drive down the disease and the impact of the disease is absolutely critical.
Can you share with us some of the current challenges facing countries given COVID-19 and the impact on malaria, as well as diseases like polio?
I think we've all seen and felt the impact that COVID can have on ourselves, on our communities, on our families, on our countries. I think what we're seeing now is COVID is starting to move into some of the lower middle-income countries in countries in Africa, Asia, Latin America, and I think it's taking a different shape here. It's very, it's incredibly impactful if you have high maternal mortality, if women stop going to clinics because they're scared of the risk of contracting COVID. We've seen, some major reductions in TB, for example. In India, for example, the case detection rate for TB seems to have fallen by 75% in the last few weeks. In malaria, we've seen something like 75% of our programs impacted in some way by COVID. And so I think what we're seeing in many of the countries we work is that COVID is representing a significant threat to people.
And how do you see things developing in the future? And what is needed to address these challenges that you've described? How is the Global Fund responding?
I think the biggest fear is that we see a control of the virus in the higher income developed countries, and the virus really taking hold and not being as well controlled in low income and less developed countries. And I think if we look at the current context, we see the real risks of that happening because countries are not able to implement the same control measures because of the economy in poorer countries and the impact that has had on people's lives. And if we don't make the investments in supporting those countries, and we don't make sure that any new tools that are available through the development processes, these accelerated processes and the research programs of many companies, then I really worry that we end up in a situation where the really serious impact on the more vulnerable could continue to increase and have significant long-term impacts on the fight against the diseases, malaria, HIV, TB, run from work on, but also many other health issues and many other issues around poverty.
And now can I ask you is, how do you envisage a Global Fund and Rotary international partnership and the role it can play?
Well, I mean, first to say, I'm really excited that we're talking. I'm really privileged to be talking on this platform, and I think I'm really pleased that we have this conversation about a partnership with Rotary. I think Rotary is an incredible organisation with a deep commitment, to people's well-being. It's shown, a huge contribution, I think, to reducing one of the world's most severe diseases in polio. in its history and been a significant actor in that. I think that the complementarity, if you like, of organisations like the Rotary and the Global Fund is fantastic. We have very similar goals in terms of supporting people and making a big difference in people's lives. Like Rotary have deep experience in polio, the Global Fund clearly have deep experiences in malaria and HIV and TB, and building the health systems that really make a difference there. And we've seen major progress across the diseases that I think we can be very pleased about. But I think we also recognise there's a huge amount to be done. And the current crisis, I think, is emphasising that if we don't work together effectively, we don't build systems that allow us to deal with these diseases and deal with the existing diseases and the future ones. Then people will remain at risk everywhere, particularly in the poorer countries.
That's excellent. Thank you very much, John. That's really appreciated.
Wait for it. You don't want to miss this next segment with Adriana Lanting of the Rotary Club of Long Beach, as she talks with Dorothy Echodu about the successes of malaria projects in Uganda.
We need your help at RAM Global. Join us to deliver mosquito nets, to train community health workers to drive malaria to zero. Your dues and your club's dues. Yes, clubs can join RAM Global. This is the time when we need your attention and help. Become a member today or donate in just a few easy steps. For more information, visit www.ram-global.org. Thank you for your help.
Thank you, Ellen. Hi, my name is Adriana Lanting, and I'm a member of the Rotary Club of Long Beach, California, USA. I also serve as the Director of Strategic Engagement with Rotarian Malaria Partners, and I'm a member of Rotarians Against Malaria Global. Last year, I spent some time in Africa with a woman who has become a hero of mine. I'm really pleased to introduce you to Dorothy Echodu, the CEO of Pilgrim Africa and member of the Rotary Club of Seattle. Not only is she young and beautiful, she's dedicated and brilliant. Take it away, Dorothy. Tell us a little bit about what brought you to work for malaria elimination and about Pilgrim Africa.
Thanks, Adriana. Well, my background is actually in physics and physical chemistry. And in 2007, some Ugandan friends of mine asked me to help them design a really comprehensive and effective malaria control intervention for a spot that was very, very high transmission for this disease. And I didn't know what I didn't know. I did not know a lot about public health, but I went ahead and did the best that I could and got involved in this amazing project and got hooked. Actually went off and learned a lot about public health and have been doing malaria ever since. Pilgrim is an amazing organization. It was founded by Ugandans in response to the LRA and started as a relief and humanitarian aid organization in the late 90s. And in addition to the malaria work, which is sort of the central focus now, Pilgrim also runs a secondary school in the northeast of Uganda that's 6 grades. And recently during the pandemic, because of the poaching pressure that there is right now on wildlife in African parks, where there are no tourists and a lot of hungry people, we have gotten involved in some anti-poaching work through something called Project Ranger, which has been a lot of fun.
I understand that where you are, there's a really high incidence of malaria. What has the Rotary Project done to address this?
Yeah, thanks for asking. So the project area we did a baseline survey before the project started, and 60 to 70% of all the people living in the area had malaria. And there are about 55,000 people living in our project area. So the project brought in a set of comprehensive interventions that control the mosquitoes themselves and also improve the access to really rapid testing and treating and medical care for the people living in this area. And those two sets of interventions, and we've used several different ones in the project, have helped us to drive prevalence down from that starting point to, at our last survey, it was 10%. So we're not looking in this geography at a place that's going to eliminate malaria tomorrow, but our goal is to sort of change malaria from this kind of omnipresent everyday burden that every family is carrying, and that every other child is sick with malaria, and every other adult is worrying about that child instead of being able to go to their fields and farm, to something that is in the realm of the other diseases that people cope with. And then from there to use even more innovative tools to get rid of it entirely. So that's our overall sort of goal and where we are in it now. But something to understand and appreciate about an area with so much malaria and such high transmission is that it's something you have to keep after. You can't go in once and distribute bed nets and then leave. You have to keep after it and work on it daily, weekly, monthly. It's a bit of a battle, but I think if we stick with it, we are going to see the end of malaria, even in places like Uganda that have some of the highest transmission rates in the world.
How many Rotary clubs? I mean, how many Rotary clubs in total have been involved with this project?
So there have been two big Rotary projects in this same area, but the current one that we are running has many, many hands. As you've said, there are 5 districts involved, and there are 14 U.S. clubs, amazing champions, and 12 Ugandan Rotary clubs involved in addition to our local club. So yeah, it's a big job, but we have many, many wonderful hands.
Aside from protecting the gorillas with this COVID-19, I mean, how is that affecting you? How are you guys coping with that, in doing your work with malaria and everything else you're doing?
So one of the really important interventions for the current project that we're running is community case management. And this is run by village health workers who live in each village, several of them. And they are trained to test and treat children under 5 for malaria, diarrhea, and pneumonia. So pneumonia, it involves fever and coughing. These guys are on the front lines, and none of them anywhere in the country had masks. So when they heard about COVID-19, and at first, information wasn't really well transmitted in rural areas either, because people aren't on the internet. They don't have access to the kind of news services that we do. So what they heard is there's a new disease. It's more infectious than Ebola. And we're a country that has a lot of Ebola outbreaks. So the fear level was incredibly high, and we had to, as a matter of, just ethics, we had to protect those health workers, but also to keep the work going. The masks were mandatory, and they would have definitely been too frightened, and so would the community have been frightened to have contact with them if they didn't have those. So this was a case where Rotary just stepped up in an amazing way. Generous Rotarians in Seattle donated money to us really quickly to buy some of the last masks in the country and get them out into the field. We changed all our protocols, gave them soap, gave them social distancing parameters, and we're able to get those out into the field right away in April. So there was no break in the work. And then we knew those masks would run out. So we needed to enter that kind of maze and rabbit hole of of ordering masks from a Chinese supplier, and this was something we just could not have done without Rotarians and their amazing network, because Rotarians put us in touch with philanthropists of Chinese origin living in the US, who in turn connected us with suppliers and exporters in China, and we were able to go through this whole process, and we were able to help another NGO that also has community health workers in the field. And altogether, we just imported over 300,000 masks into Uganda, and all of those are being distributed right now and protecting health workers. So just the amazing power of Rotary at work.
So Dorothy, how do you see RAM Global and Pilgrim Africa working together?
Well, we have a mission, don't we? We have to educate the world about how to end this disease. We were able to eliminate malaria in the US in the late 30s. We can definitely eliminate it in the rest of the world. It just takes everybody getting excited about it. It takes a little bit more funding than we have now, and it takes the willpower and vision to see it through. So RAM Global has that, Pilgrim Africa has that, and we need to work together to give it to everybody else.
Dorothy, thank you. It's been such a pleasure to see you again, and such a pleasure to talk to you and kind of share the message of all the great work that you're doing with everyone. So thank you so much.
Oh, likewise, Adriana. Such a pleasure, and thank you.
Ellen, back to you.
I hope you've enjoyed our brief journey around the globe to get a small glimpse of the important work Rotarians are doing to eliminate one of the oldest and most deadly diseases known to man. I hope your time with us has been valuable and encourages you to help us in this fight. Malaria is a disease that can be defeated. So the question is, do we have the will? Please, I urge you, join us now, today. Log on to www.ram-global.org and sign in and join with us, and let's work together and make history of this disease.